So we had a very intensive 2 days at the joint workshop between the European Federation of Periodontology and the International Diabetes Federation, discussing the evidence for periodontitis and diabetes and the associations, and updating the evidence from the 2012 workshop. So we've produced 3 consensus papers, one on the epidemiology, one on the mechanisms, and one on the impact of periodontal treatment on diabetes outcomes and complications.
While what is coming out is that this disease of the teeth can influence diabetes control and even the development of complications, particularly cardiovascular complications in diabetes.
The patients that have both diseases, or those patients that still are undiagnosed, and either with the medical doctors or with the dentist, we can provide the screening mechanisms to diagnose the disease in case they have it.
Diabetologists don't look systematically to periodontal status, and this is probably a kind of mistake because a relationship between diabetes, type 1 diabetes, type 2 diabetes and periodontal disease is now clearly validated in the scientific literature.
I think the main message to the medical community and to diabetologists in general is that they should be considering oral health outcomes and making appropriate referrals to their dental colleagues, as they have been to cardiologists, ophthalmologists, and podiatrists, for example, for many years.
And it's well established that people with diabetes will have more advanced periodontal disease, and that would lead to an earlier tooth loss.
By treating periodontitis in somebody that has diabetes, we are capable to reduce actually the glucose level and the level of glycated hemoglobin. Namely, we in a way enhance the chance of the treatment of diabetes to be more effective.
So I think the main message to diabetologists and to the general physician is to always remember the common risk factor approach, which has been adopted by the World Health Organization. Diabetes and periodontal diseases can be done if diabetologists and periodontal surgeons and general dentists work in sync with each other and try to solve the problems.
The best studies, cohort studies with long samples, has also demonstrated that those people with worse periodontal condition have more problems for the control of glycemia.
We know today from recent evidence that periodontitis may have an effect on pre-diabetes. So people with periodontitis may be screened in the dental office for pre-diabetic condition, and early treatment may reduce the risk for developing diabetes.
People living with diabetes have to go annual checkups for ophthalmologists, or you have to go every 3 months to check your HbA1c. It is also very important, and we would like to highlight the fact that the annual dental checkups are also very important to avoid the long-term side effects of diabetes.